You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with small diameter or mini implants. With us, we have an expert on the topic, Dr. Shelane Jenkins. Dr. Jenkins, welcome to the program.
Thank you, Randy. Thank you for having me. It's such a pleasure being here.
Thank you. Now, I know you brought some models, and I've got lots of questions for you about these small diameter mini implants. But for people that don't know you, I guess you and your husband are a team.
Yes.
Two different practices.
Yes.
So who's your typical patient, and what are the different services that you offer?
So my husband and I have been working together for the last 10 years. We've got two separate practices, but we work as a team in the two different offices. And so the typical, services that we offer to our patients would be from, on the lower end, bleaching. We do crowns and bridges. We do dentures, partials, implants. Those are pretty much the typical services that we offer. So the mini implant patients, there seems to be two categories of those. There are patients that have one or two teeth missing, and we can, fix that. We can give them a new set of teeth. We can give them a single tooth replaced implant, single implant with a single crown. And then you've also have the denture wearers,
Okay.
These have been patients who've had their dentures for years, and then they've never been given an option of, what can we do from now on? Those, we can actually snap their dentures on, their existing denture. We'd prefer to give them a new denture, but their existing denture can be used to be snapped onto the implants that will be placed. So these are people who we give a brand new set of teeth supported by the small diameter implants. And they come in, they might not have teeth, and they leave with a brand new set of teeth that they can go ahead and they can bite into an apple. They can eat a salad. They can enjoy being, at the dinner table eating what they want again.
Now, there's a difference between the regular implants and these mini small diameter implants.
Yes.
You love these smaller implants. Why?
I love them. I love them because we're actually feeling like we're giving people options that they weren't given before.
Okay.
And they come in, they don't have any teeth, and or they have dentures, and they don't like the dentures. They fall out. They can't smile. They can't they can't laugh or throw their heads back like they normally would, like you and I would.
Okay.
But now you bring them in. There's no surgery. It's, a few hours in the chair, and they go home, and they, a lot of times they'll call us, within a few hours, and they're like, are you sure I can bite into an apple? Are you sure I can go out and eat dinner tonight? And so it changes lives. Gives them a different perspective, makes them understand that, listen, I can go out and I can socialize with my friends again. I can eat what I want. I can feel like a whole new person. So back to your original question, why I like, mini dental implants, these small diameter implants versus the traditional implants.
Yeah.
Now, traditional implants are great. They serve their purpose for a long period of time. Now, with Dr. Todd Shatkin, he did a study that's probably about 12 years old now,
okay.
And it followed over, I want to say, about 5,000 patients for over that period of time,
okay.
And there was it was actually a 92 to 93% success rate comparing the mini dental implants to traditional implants. And so, the mini dental implants, they are, they're half the cost.
So they work. Now, your mother, we talked a little bit about your mother. Would you put small diameter mini implants on your own mother?
I would.
Okay.
I would put them on my mother. I would put them on my husband. I would put them on myself.
So you believe in them?
I do.
You say they're half the cost.
They're half the
of
cost.
Regular implants.
They're half the cost of regular implants.
Now, I have dentists that have been on the show, qualified people, and they say the problem with mini implants, they're just too small. Is that old thinking, in your opinion?
That is old thinking. They also said they're too small. They also said that, people didn't have enough bone for implants. And, we've had patients who've been to other offices and, they come to us and they're like, Doc, I've been told at this office I don't have enough bone. I've even been told by my general doctor I don't have enough bone.
But isn't it true? I mean, if you've been wearing a denture for like 20 years, you don't have enough bone to do this.
That is true. That's an older way of thinking. But, with this new mini dental implant, small diameter implants, and also with their new imaging system,
okay.
We're able to provide patients with teeth, not only with teeth, but the ability to go out and enjoy what they're eating. And a lot of times, especially with the dentures, what would happen is it covers your palate. You can't taste.
Okay.
You don't know what your food tastes like. I mean, Can you imagine living life, Randy, without being able to taste the food in front of you? I mean, you can see it. It looks great. You're salivating and you put it in your mouth and it's like, wah, wah, wah.
So it's like bland or something because the roof of the mouth is covered?
Because it's all covered. But with these small diameter implants, the roof of the mouth is not covered. The dentures snap in, they're stabilized, and patients can leave the office that very same day, and they can eat what they want and enjoy. Corn on the cob, they can eat ribs, they can bite into something and enjoy it.
So you're near Fort Myers and Sebring.
Yes.
Is that right?
Yes.
Are there a lot of people wearing dentures?
Oh, Randy.
Or headed to dentures?
There are a lot of people, case in point, like Hertz Arena in Fort Myers, Florida.
Okay.
We could fill that arena 10 times over with people who have, 1 or 2 teeth missing, 6 teeth missing, people who have an upper denture, or people who have upper and lower dentures. We could fill that stadium multiple times. But, the issue with people with dentures, the dentures aren't attached to anything. They're not attached. So with these small diameter implants, we can now stabilize the dentures by attaching them to the implants. And like I said, a lot of times, the patients come in that afternoon. We can do the procedure. It's non-invasive, and they go home that afternoon, and their dentures snap in.
So it's minimally invasive.
Minimally invasive. Yes, it's very minimally invasive. You literally place a small, incision, small hole, I should say, in the area of where you want to place the implant. You place the implant. It's a 1-piece implant, and then that afternoon, after we do that, we fit the dentures to the implants, snap them in, and patients go home that afternoon. A lot of times, they call back the next day and they say, "Doc," or actually, don't call back. We like to call and check on our patients, and they say, "Doc, oh my God, I don't have any pain. Am I supposed to have any?" It's really good. I'm comfortable. I'm biting into things. I'm
Really?
trying things out, that I've never tried before. So can you imagine not being able to function like that? Being able to relate to other people. A lot of these older demographic, they make excuses. They don't go out and eat because they're like, "Oh, I've got to go do something at home," or "I got to go watch my favorite TV show." When truth and point is, they're afraid their dentures are going to fall out. They're afraid they're going to leave their dentures somewhere.
Do they say this?
They do. I had a patient, bless her heart, amazing lady. And she came in and the joke was, she's like, "Doc, I left my denture in the movie theater."
Oh my goodness.
And here comes, this nice, attractive young gentleman running to me, because and he said, "Well, are these yours, ma'am?"
Wow.
She had forgotten.
That's embarrassing.
It's completely embarrassing. So can you imagine living life like that and being able to transform someone's life, actually being transformative, is what the mini dental small diameter implants are about.
So is this the future of dentistry? Like 10 years from now or 100 years from now, dentures as we know them won't exist? They'll all be attached to something?
They will all be attached to something. This is the future of dentistry.
Okay, now people need to know, if they're watching this,
Yes.
they're also going to meet your husband.
Yes.
Because he helps with the surgery.
Yes.
And you you call
With
it the restorative.
restorating,
Okay.
yes.
So tell me about him.
So we're classmates.
Tell me the bad things about him. He's your husband.
Oh,
I'm just
boy.
kidding.
It'll take all day. I'm just kidding. No. But truth and point is, he's had a lot of training with placing the small diameter implants.
Okay.
He places the implants. He does the that portion of the treatment, and I do the portion of restoring them.
Okay. You said patients like him.
Yes.
Really like him.
They do. They actually love him.
Because people don't like dentists, right? Is that true?
Oh, people
even
don't.
you, like a
People
female, do they
don't.
even say?
Oh, I hear it
no
all the
offense?
time.
Really?
I hear it all the time, and I say, no offense taken. There is a stigma attached to it. There's pain. Let me. Case in point, you're a denture wearer. You've been before you were a denture wearer. Here's your life.
Okay.
You've been to the dentist 15 years, 20 years. You had a root canal on a single tooth, and that root canal failed. Then you had to have the tooth extracted. Then you had to have a bridge, and then the bridge failed, and then you had to take that out. And then finally, when the teeth are out, patients are just like, "I'm relieved. I'm relieved. I'm done. There's no pain.
You just have your denture, don't have to worry about it.
You just have your denture, and of course, the first week is torment. But we as human beings.
Why? Why is the first week
Because
so bad?
it's something in your mouth. You're not able to chew as well as you need to. You can't taste your food. And as a human being, your brain is telling you, "Oh, there's something in your mouth," so you're salivating, and you have to cut your food up. So this whole level of adaptation to a different way of life, even though you're relieved. You're like, oh, no more pain. I don't want nickel and dime. I don't have to go back and see them.
Yeah, because it's a lot of money.
It's a lot of money. It does add up, but that's how denture wearers, unfortunately, they don't think that's how they perceive the dentist. They don't want to come and see us anymore because they've been through all of this.
So you say when they go, you take a denture wearer, and now you give them teeth that don't come in and out of their mouth.
Yes.
Like a brand new set of teeth. It's like a life-changing for them.
Life-changing. It's a third set of teeth, and case in point, you have people, when you meet someone, the first thing you notice, I know I'm a dentist, you notice is their smile.
You probably think it's the most important thing.
You notice their smile. You notice that. Case in point, I had a patient. He was never given the option. We've been seeing him for several years.
He's wearing a denture?
Wearing a denture. Okay. He and his family, they come in and I gave him the option. I have never seen him smile. I've never seen him smile. After we gave him the option, now granted, we have not done treatment yet.
Okay.
Whole different person. He's smiling, he's talking, he's joking with the staff, and just case in point, giving someone an option. Giving someone an option they've never been presented with before changes their lives. And that's what these small diameter mini dental implants are doing. We're changing people's lives.
Yeah, but what about those people that have gum disease, like the bleeding gums, bad breath, loose teeth?
Yeah.
Are their gums too bad to get this done?
So,
aren't they more likely to fall out if you have gum disease?
So those are the people we get. We get those people all the time. They walk through our doors. So what we do is, you take the tooth out, reduce the infection, get the gums healthy, and you can place these mini small diameter implants, and they get their teeth, and the infection's cleared up, and they're able to retain these dentures with the small diameter implants. So that gum disease, that's something that we can treat, and it does not impair us from using the small diameter implants.
Now, we need to mention, so Medicare doesn't cover this. Medicaid doesn't cover it. Even the best dental insurance only covers a very small portion. So what's the answer to this?
So yes, not even the best insurance, will cover it only, up to $1,500 or so. Okay. Well, in our office, yes, we want to maximize the total amount that you have with your dental insurance. But so we also offer financing,
Are people financing this?
Oh, yes. Oh, people are financing it. When you give someone the option of being able to do something that they haven't done in years, and they never thought that they'd be able to do again, of course, they're like, where can we sign up?
Okay.
Where can we, how come I never heard about this? But then again, of course, if you've been wearing dentures for all these years, you don't come to the dentist.
So you want to know your options?
You don't know what your options are.
How old can you be to do this?
Oh, I've got a patient, 93 years old.
What? Why would a 93-year-old want to do this?
Oh, that perfect question.
Okay.
So if you're 93 years old, what do we function around as human beings? Our families, our friends, and where are we at mostly? We're eating, we're out, we're socializing, we're talking. So when a 93-year-old, she wants to be able to sit down and cook a meal for her family and sit and enjoy it with them. A lot of times she said to me, I cook for them, I taste it, I really can't taste it. I have my daughter taste it. And then I just sit and I watch them eat because I'm too ashamed. A lot of times I have to take my dentures out and then I go eat because I don't want them to see me without teeth. So a 93-year-old, which is, 80 and older, that's...
So 80, no big deal. That's not old at all.
No big deal.
What if you're on a couple of medications? Because most people over 75, I was just reading an article, are on 5 meds or more.
Right.
You can still work with those people?
Of course, yes. If you are able, regardless of what kind of medication you're on, and we're always going to make sure that we take care of the whole person and make sure that none of these medications are, something that's going to inhibit you from being able to function.
You may have to call their medical doctor.
You may have to call their medical doctor, but that doesn't stop us from being able to, to place the implant and give them a new set of teeth. A lot of times what will happen is if they are able to walk in on their own, they're able to get these small diameter mini implants.
Now you're big on sedation because people are afraid of the dentist.
Oh, they are.
You do oral sedation.
Yes, we do oral sedation. So a lot of times what we do is we make sure that you're not taking anything that's going to be contraindicating, and 9 times out of 10, most people are not. So we give you a prescription. You know, a lot of people, they say, oh, doc, I can't sleep the night before I come see you. You know, they come in and they're already agitated. So we give them a prescription for an oral sedation. And what they do is they'll take a pill the night before that relaxes them, helps them to sleep.
Is that right? The night
Yes.
before? Okay.
And they'll come in, you know, they'll be very relaxed. So it helps us and it helps them to be able to go through the procedure and not have that level of anxiety or that level of fear.
Is it true sometimes they after the procedure, they wake up, it's like they have very little memory of the whole thing?
Yes.
Really?
Yes. For a lot of the oral sedation, what it does is, you know, it's like retrograde, you know, amnesia. You have a little bit of, you know, you don't remember the procedure. So we had one patient come in, we, you know, did a full mouth extraction. We gave her a new set of teeth that were, you know, retained by her implants. She came in the next day for a follow-up and she said, I don't remember anything. It was the best
that's good.
appointment ever. And then on top of that, and then she said, these things are wonderful, my teeth. She's like, and she started smiling. Oh my goodness, I don't think there was anybody in the office who was not emotional about the visit because she was just beside herself with the ability to be able to smile and smile widely and laugh. And she said, I'm gonna go try these things out. What can I try them out on? I said, well, what would you like to try them out on? She said, well, and she thought about it.
Okay.
And then, you know, we all thought, oh yeah, she's gonna say, you know, like corn on the cob or something. She said, I just wanna be able to bite into a carrot.
Okay.
Just a carrot. And she called us later that afternoon. She said, I had the whole bag of carrots. So, you know, yes, oral sedation helps to make the patient more comfortable and have a more pleasant experience in the dental chair.
Now, what about downtime? Like, what? I mean, if everything works out, what's the downtime like?
Oh, that's the best part. You know, with these small diameter mini dental implants, there's less downtime. You know, these, you know, there's minimal downtime. You know, for a lot of times with the traditional implants, you know, you'd have to wait a certain period of time before you were able to even be able to get a new set of teeth and function with them. With the small diameter implants, or be able to chew with them. With the small diameter implants, the very next day, actually that night, you've got patients who are biting into stuff. As a matter of fact, I had an 83-year-old married for 67 years, 67 years. And his only concern was, I want to be able to take my sweetheart out to eat.
Okay.
We haven't been out. I'm too, you know, ashamed of my teeth, of my smile. Doc, can I take my wife out? I said, of course, please do. When he came in for his follow-up, oh my goodness, the best story ever. He said, I had the best first date in my 67-year marriage.
That's a nice story.
That I've ever had. So things like that is what makes me so excited about doing these small diameter implants.
What do they like more? What they could eat or how good their smile looks?
Oh, wow. So, you know, here's the conundrum. It's funny. You've got there are two sets of patients. One set, they want to have a great smile.
Okay.
And, you know, we do that. You know, we give you, you know, depending on if you're a female or a male. A female, we give you, you know, rounded teeth, softer looking teeth, and we place your teeth like that. And, you know, we match the shade, and a lot of times we'll compare them to, you know, maybe a picture that you've had when you were younger and you liked those teeth. And, you know, they go out and they haven't had a salad, say a salad in years with croutons, you know, and imagine almonds and cranberries and everything. And they love them because now they can eat what they want. And then you have the second set of patients, you know, they are just concerned about, what can I eat with these? What can I eat with my teeth? And they've got a laundry list of what they want to go home and eat that night. As a matter of fact, a lot of them probably prepared the food and have them at home to eat them. And they go out and, you know, they go out to a restaurant, or, you know, they go out just, you know, with their friends, and their friends go, did you do something different? You're smiling more, you look happier. And so, you know, you've got both sets that, you know, we make sure that, you know, you're able to function, or not function, but able to eat what you like. And then you've got the other set, they love the appearance of their teeth. So, you know, it's a funny thing. You've got the people who want to be able to chew and eat these foods, and, you know, then they go out and they get a compliment, and then they get another compliment, and then they love how the teeth look, and, you know, and they smile more, and they, you know, they're more attracted to other people, and they, you know, might start dating, you know. And then you've got the other set of people who, you know, they want to be able to have nicer looking teeth, and then they love how the teeth look, and then they're able to chew, and then they're able to eat an apple or bite into an apple, or they're able to, bite into a pizza, a slice of pizza. And, so either set of those people,
they kind of shift a little bit.
It shifts, it's, you might come in for one thing and end up realizing, oh my God, this is what I really wanted all the time.
So on Facebook, after talking to you on the telephone, that some people never smile on Facebook. Is this one of those things that after it's all done, now all of a sudden they're selfies and
there's selfies everywhere.
They're like obnoxious now with their photos.
And rightly so. Now you've got your smile back. For some people, you got your personality back. For some people, never even had a Facebook account, and they opened one because now they feel like socializing and catching up with people who, because this was something they did not like about themselves. If there's something you don't like about yourself in life, it's going to hold you back.
Okay.
And a lot of people, there's a large demographic, it's their teeth. You don't like your teeth. You can remember probably when you're younger, there's probably that one person you've seen or you're related to that when they smile, their hands up, or when they're chewing, their hands up, and so for us being able to create or allowing to give these patients their lives back,
Can you spot it? Because your husband's a dentist, you're out and about, and you could spot who's hiding their smile?
Yes. It's, and unfortunate to say, there are a lot of people out there, and it might not be, you could be thinking you've got bad breath, you don't like your teeth, you don't like your smile, and we tend to see those patients all the time. We see people like that all the time.
We're short on time. So, and I know you brought those models. I'm not sure what you're going to tell me about those, but if a patient goes to you, they're either one of the two categories, a denture wearer or they are headed to dentures. You cannot save their teeth.
Right.
What are their options when it comes to these mini implants?
So there are a few options for, the patients that come in. We come in and we talk to them about their options. You've got, if you want something that snaps in, snaps out, you've got a lower denture that sits on 4 small diameter mini dental implants. That's the lower.
Let me see that for a second.
Sure.
And what could you, and with this you could eat?
You can eat
a lot better than
with regular dentures that don't snap in or snap out. You can eat corn on the cob. You can eat carrots. You can eat peanut brittle. You can.
So that's a snap in, snap out.
That's
option.
A snap in, snap out option.
Now what about the upper? Same thing.
Same thing
snap
on
in,
the
snap
same
out?
thing on the upper. You probably will have you will have more implants on the upper because you want it to stabilize more.
Is that the upper right there?
This is the upper. So this has 8 implants.
Okay.
And you'll hear the same snap for that one.
Okay. So and you show them these models when they come in.
We show them the models.
So snap in,
snap out.
No more adhesive at all?
No more adhesive.
Maintenance
no
on
more
this
wafers.
a little bit when you do a snap in, snap out?
There's maintenance where, we want you to come in at least twice a year. We want to make sure that everything, all your implants are well maintained. We want to make sure your gums are, healthy, and you're taking care of your dentures, your teeth. You want to make sure that those look clean. There is a tiny little bit of maintenance in terms of, there might be a little bit something that we may assist you with in office.
Like an out-of-pocket expense, possibly with the snap in,
a minimal,
snap out.
yes,
Okay.
and with a snap in, snap out. So the next level up are teeth that don't come out, on probably about 8 implants, and a lot of times, we put a little anecdote in it. We call it grade on 8. Put them in, they don't come out, and all you do is make sure you maintain it. Of course, like a water pick or brushing or whatever. Brushing, water pick, and then of course you make sure that you come in to see us at minimal, maintenance. At least once or twice a year.
But it sounds like that's what everybody wants, right? Teeth that don't come in and out.
Oh,
it's just a little bit more expensive, I guess, for the fixed teeth?
Yes, just a slight, additional fee for that. It's kind of funny. I was in a consult with a patient, and, we were showing her, this snap in, snap out, the model, and she saw another model, and she was like, well, I did a little bit of research, doc. Is there another option? And she ended up going with, the fixed one. It's a little bit more, but she did not want to be bothered with, having something that she'd have to take out and put in. Because her rationale was, my husband's never seen me without teeth.
Okay.
And we've been together, I think she said they were together for 20 years. And she said, I'm not about to start now. So yes, the fixed on 8 is also a good option to have.
Okay.
Yes.
Now, I know a couple of denture wearers.
Yes.
They never complain about anything. Are you saying it's because there's no such thing as a happy denture wearer?
Well, I don't think that they're going to come to you, Randy, and be like, Randy, look at my denture.
Okay, good point.
Can you tell me what's wrong with
me?
If there's something somebody doesn't like, they're not necessarily going to complain to someone about it.
But
or
you
to a
hear all the
friend,
stories.
But we hear all those stories. You know, a lot of times the comment that will be made is like, this is probably the worst mouth you've ever seen. This is probably, you know.
Is that right?
All the time. All the time. But, you know, their family and their friends will never know. You know, they'll never know because this is something that they are ashamed of. And it's holding them back.
Now, we talked about this in the green room, and you were saying that, and we were talking about this, that when you have bad teeth, you don't smile. So they don't, because like I was telling, look, I don't see people with bad teeth. And it's a good point you bring up. It's because they don't smile.
They don't.
So I'm not seeing it.
Right.
And so the patients will say this is the worst because they never see it either.
They never. You know, they don't complain about it. You know, they don't want anybody to know. You know, they don't want their family or friends to know that, you know, oh my God, my teeth are horrible and this is happening. For some of them, it might not be, you know, the teeth in the front, it might be the teeth in the back, and they never tell their family members.
And you say some of these people with really bad teeth, they brush and floss more than regular people.
Yes.
But because of this bacterial infection, they can't stay ahead of it.
They can't stay ahead of it. You know, they can't. And so a lot of times, you know, of course, with the bacteria and the tooth being the source of a lot of the issues and infections, you know, you come into our office, we do the extractions, minimally invasive placement of the implants, you leave with teeth that same day.
Okay, now, you had a lot of training.
Yes.
In these mini implants. In fact, I think next week or something, you're traveling instead of going on a vacation.
Yes.
You said you and your husband were going to go on a vacation.
Yes.
He's a dentist too.
Yes.
And you've decided to go to another mini implant training.
Yes.
So there's that much to it.
There is. And
like engineering of it? Is that?
No, it's not engineering of it, but it's just a lot of different, let's put it this way.
Okay.
If you believe that you have something that changes someone's life, we as dentists, we don't get thank yous a lot. You know, you do a root canal. Do a root canal. Who's going to jump up and be like, thanks, doc, that was the best root canal ever? You don't get that. But, you know, with these small diameter mini dental implants, we are changing people's lives.
So when you give them their teeth back,
we give them
they're
their
appreciative.
teeth. Oh,
appreciative.
They're beside themselves. You know, they're smiling. They're doing things they never thought they could do. They're skydiving. They're biking. They're
It's like
socializing.
It's like those hair commercials. Guy gets his hair, he's hiking and swimming.
A whole different person.
Same kind of thing you do when you get your teeth.
Exactly. You know, they're starting to wear makeup. You know, they're wearing clothes that they, you know, they never thought, you know, they would want to be in. You know, things of that nature.
Okay, we're out of time. Final message. Somebody watching this, they either are headed to dentures, bad teeth, or they're already wearing dentures. What do you say to them? And for whatever reason, they're still afraid.
Come in.
They've heard what you had to say.
Yep, come in for a free consult. You know, we want to talk about your options.
They'll meet with your husband as well?
Yes, they'll meet with our team. They'll meet with my husband. They'll meet with myself. They'll meet with my staff and my team there because it is a team effort.
Okay.
And we will talk about their options of being able to give them their teeth back, give them the ability to chew and to enjoy the foods that they never have or they haven't in years.
Okay, good. I want to thank you for coming in.
Thank
Great
you.
information. They can go to your website, find out more, and make an appointment.
Yes.
Did they get to see you and your husband?
Yes.
Okay, good.
They do.
Thanks again.
Thank you.
You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.